This morning I thought what I'd do is just have a really quick discussion about the chemistry of cannabidiol, for those of you that are a bit more advanced and understand these kind of things, and run through a few of the biochemical effects. I'll just put a disclaimer in right here that I am not claiming that my product has any of these effects or any kind of medical effect whatsoever, just with my obligations under UK and EU law. So this is just about cannabidiol itself. So what I'm going to do is I'll do this almost as if just a train of thought. It might be able to help you guys understand a bit more. So the interesting thing that starts off with cannabidiol is the fact that it doesn't react with the cannabinoid receptors in the same way that you'd expect. It too, as a cannabinoid, it has really weak interaction with CB1 and CB2, which are main cannabinoid receptors, and they're throughout the body and the brain. CB2 is mainly more in the abdomen, etc. CB1 tends to be a bit more in the brain. It's similar to kind of the HDA receptors, 5-HDA receptors, where you have some that are more in the brain, some that are more in the gut. It's the same kind of thing, but it doesn't really react with those. It's not an agonist of those, but what it does do is it antagonizes them, but not fully. It antagonizes their agonists almost, so it delays effect and it modulates it, which is an interesting thing. There's a few other systems that it actually operates on. It's 5-HTA receptor agonist, and what 5-HTA is, it's 5-hydroxytryptamine, otherwise known as serotonin. So what you get here is that the cannabidiol hooks onto the receptor, and that's the serotonin receptor effectively in the brain. So whereas SSRIs prevent serotonin going out of the cell, what cannabidiol does, it bypasses that system and just hooks straight onto the receptor. So that's an interesting bit of chemistry right there. There aren't many other compounds that do that. Buspirone is one of them, which is a kind of newer generation anti-anxiety drug. In terms of other effects, it's certainly neuroprotective. It stops oxidation of stuff, so it's good as an antioxidant. It's better than vitamin C and E in that sense. And I'm talking about the chemistry here, not medical effects again. It also acts on something called the vanilloid system, which is things like capsaicin, which is in chili and spicy food, hooks onto that system. It has effects with that, so it does that too. I think the most interesting thing about it is just the range of effects. The fact that it modulates cannabinoid function. It's been shown to make the effects of THC less severe, so when they're in combination have a bit more helpful effect rather than people stoned out of their skulls. So that's one thing. Now, in terms of how it works, it's probably the first agent ever found that does modulate these cannabinoids. So specifically, I'm sure other things do. I'm sure how you eat does and that kind of thing, but that's what it does. So it does a lot of interesting stuff, and there's more interesting chemistry that I can talk to you about as well.